I really love to understand how these ideas have been applied in practice and kind of how really has AI supported care at Ang Mo Kio Thye Kwan, right, in a way that strengthens community of patients and caregivers without really adding to the noise and adding risk, right? I want to hear about some of the experiences that you might have.
Okay, let me try to think of a couple of anecdotes or stories to share. But maybe I'll focus on the robots that we have. We have Thye robots here at the community hospital. So I think making sure that such technology is utilized and utilized well is important. So for us, we really have to prepare the ground, make sure that there is standardized orientation that would also lead to freeing nurses' time, for example, in doing some of the more repeatable, I wouldn't want to say mundane, but repeatable tasks or tasks which that really automation, technology, and equipment can help with. But sometimes it also supports safety as well. So that is something that we can consider. So coming back to the Thye robot, for example, I think gait monitoring as well as fall detection through the robot, as well as engagement with the robot and between the robot and the patients is important for us. But focusing on gait monitoring and falls management in hospitals and preventing incidents, such technology is able, at least we have seen, even though not much recorded research has been done in Singapore in terms of alerting staff early of these incidents. But I think that's something that research will address quite soon, and we would also like to embark on that. Working with Board MD, I think the project has so far been very good as we move from the different phases. But the initial feel and the use of WhatsApp-based touchpoints, I think it's helped to extend education and support as well to the patients and caregivers even after they are discharged from the hospital. And this is very important. I think a lot of our past patients as well as caregivers, when they try calling the hospital, if they get an automated call facility or a solution, they will just say, hey, I want to talk to a real person. So I think this change as well within the community and the acceptance rate, the higher acceptance rate of the public in terms of how they interact and communicate with us through AI, or in this case, even using WhatsApp with an AI. I think, it's helped us.